Hello, so the usual disclaimer, enjoy these videos, they are meant for entertainment and education purposes, so don't try things that you see on here on yourself or other people. So this lady's come for Verruca needling, which is a way of getting rid of verrucas, and it requires a local anaesthetic. So this particular local anaesthetic is what we call a tibial block. So we're going at the inside of the ankle here. That little circle is just to make sure that I'm in the right spot. And what I'll do is I will inject a certain amount of anaesthetic, and that with the intention that that will knock out and numb the undersides of the sole of the foot, or at least the majority of it. So this is it's not that bad an injection actually. There are other ways we can inject for needling, and we can go in the sole of the foot, but that tends to be a little bit more of a painful injection. And like I say, this one isn't that painful at all. So that's the injection done. Now we wait for it to go nice and numb. And this lady is suffering with verrucas on the heel of her foot. So here they are before we've taken the callus off, and here they are after the callus has been removed, so we can see what we're doing. So now it's nice and numb, we're going to start needling it. So this is the gory bit. Essentially with needling, verruca needling, also known as Faulkner's needling, we are essentially inserting a needle hundreds and hundreds of times into the verrucas. Now, like I say, we'd have to do this while the tissue is numb, because there's no way you'd stand this otherwise. But yeah, so we pass the needle lots and lots of times into the tissue, and the idea is by doing this, we are trying to expose the virus to the immune system, the bigger, beefier immune system. So the viral cells, which verrucas are caused by HPV viruses. There's about 5 that they know that commonly infect the foot, and we just call them verrucas. But yeah, they're a wart virus. There are many different strains and types of wart virus. Warts on your fingers and things the same. We know about genital warts, etc. So some HPV viruses are known to be cancer causing, but the ones that cause verrucas are not. So apologies here, because I know the lighting's not brilliant. So HPV viruses, we can pick them up all over the place with verrucas, etc. They tend to be in from communal areas, and the understanding is that if you have a little bit of an abrasion on your foot, like a rub, that disturbs those top layers of the skin, and then it is exposed to the virus can get in there. And it kind of invades, if you like, those uppermost layers of skin in your epidermis. So where they sit there, they're also very canny. They kind of wrap themselves within an enzyme overcoat. And so those kind of lesser immune cells that kind of poke their nose around those top layers of skin, no, they're there, but they're kind of being masqueraded as something very innocuous and not really problematic. And in all intents and purposes, HPV viruses, certainly on the foot, aren't any real problem. People don't often like them being there because of the sort of stigma attached with verruca, but ultimately they don't tend to cause any great problem other than getting uncomfortable when you get a layer of hard skin that develops over them. But on their own, there's no desperate need to get rid of them, but often people do like to. Verrucas can take any length of time. They do and can go on their own with no treatment whatsoever, and that is often just a case of waiting for your immune system to recognise what it is and get rid of it. Now, for some people, they don't go that easily, and they can hang around for years. So this method of treatment has been very, very useful in treating people with verrucas just like that, ones that have kind of stood the test of time and haven't gone of their own accord. So like I say, these immune cells sit there, not really causing any problems. The idea with the needling is by passing the needle through areas where these virus cells are living, we're stripping away this enzyme overcoat, and we're injecting these tiny little amounts of virus into the lower bloodstream, into the dermal area, and where the bigger, beefier immune system lies. Now, whereas before the immune system's kind of gone, well, I know you're there, but you're not really causing me any problems, so I'll leave you alone. Now it's like an invasion. So those immune cells are then like, hang on a minute, I'm going to deal with you and I'm going to sort you out. Now, this lady has obviously these verrucas on her heel, but she also has some further up her foot near her little toes on the sole of her foot. Now, we wouldn't treat all of the verrucas. That's not the idea with this. The idea is to say initiate this immune response, to get this immune system working. Now, once you've initiated that response, all the other verrucas, wherever they may be, even on the other foot, should go away if they are the same type. So like I say, if it's the same strain. Now, this lady's verrucas all look to be a very similar strain. It does happen sometimes that people have more than one strain infecting them, but typically it's just the one strain. So we're not treating the ones near her toe, we're just treating this area around the heel, and hopefully we'll get that immune response and any other verrucas that are hanging around will go. Like I say, verrucas do often go on their own, and one of the signs that they are going to go is that they get worse. You find that they get worse before they get better. We don't offer this treatment for children because they nearly all the time they do go on their own, and so this is really reserved for adults, for those ones that have hung around for ages. There are plenty of other treatments out there, but the success rates for this one just are really good in comparison. So for one treatment, a lot of people will find it goes on one treatment, but not everybody. We give up to 3 treatments. If it's not gone on 3, it's unlikely that this treatment's going to work for you. But if it's not gone on 1, often the second treatment is enough to kick it in the bum and get rid of it. But for those people who don't get rid of it, often they find that they improve a lot. They get a lot smaller and more manageable. So they get a better result, even if it's not the one that they were hoping for. So the different treatments that are still available today are things like the caustic treatments, so like acids, etc. And your things like your Verruca, which is salicylic acid, and cryotherapy, which is the cold treatment. Now, both of those treatments work on the same principles of trying to create a very thick blister. So they kind of burn down in different ways to create this blister, with the idea that the top layer of the skin then kind of shears away and takes with it any verruca tissue with it. It does work to an extent, but unfortunately verruca cells don't kind of live in a nice flat linear manner, so they're not in layers, if you like, and so when that blister comes away, you only need a few cells left behind, and then it replicates and you're right back at square one again. So with this treatment, because we're trying to initiate that immune response, we do tend to get a far better resolution rate of up to about 70%, has been reported in some papers, whereas with the other treatments you can run at anywhere around 30%. Now I'm just cleaning the wound off now. We're getting there, but we're not quite where I want it to be. So the verrucas I will keep needling until they offer very little resistance. So I'm getting very little skin resistance. And you'll notice in the next sort of few minutes that they start to look quite bulgy. They start to sit quite proud and look like they're kind of sticking out of the foot a bit. And we also want them where they kind of look a bit beefy, so a nice kind of meaty look to them, but they do change consistency quite a bit throughout the process. So I've still got a little way to go here yet, but we're very much in the right direction. So this lady has had a needling treatment before, a good few years ago, at a different practice, and unfortunately it didn't work, as you can see. So like I say, you know, she's still within the realms there. Now, after the treatment, we do give it a good 6 months, because often the resolution, if it's going to come, doesn't happen straight away. So it is waiting for your body to kind of kick in and deal with it. So yeah, we try not to get like discouraged if it doesn't look like it's really changing, and like I say, sometimes it can take a few months and sometimes it's a little bit quicker. But where verruca tissue kind of looks like dotty, sort of lumpy, spotty tissue, good normal healthy tissue has like your fingerprint lines in it. It's like fingerprint skin. So when we're looking for improvement and resolution, we are looking for those fingerprint skin lines, rather than kind of like areas that you could tell, like in the first, at the beginning of the video, where you've got like these little areas with like kind of dotty, spotty tissue in. So you can just see now that this is starting to like protrude a little bit, and you can tell there's not as much resistance going on when I'm popping that needle in. I know it looks like on the screen I'm just wiggling the needle around. I'm not. I am actually removing it entirely from the verruca and then reinserting it. And you can see it's starting to kind of bulge out a bit. Now, there is a little bit of bleeding, of course, but people expect that there's going to be lots and lots of bleeding. You can see that just isn't the case, because each of these little puncture wounds are tiny little holes. They do coagulate very quickly, so actually bleeding isn't really an issue. And you'll see, say, towards the end, it does stop bleeding very, very quickly. So it's not as gory as people imagine. So you can see now that that's looking far more what we're wanting. It's starting to, you know, kind of protrude a bit. It's, say, looking quite beefy. There's not as much resistance when I'm passing the needle through it. So we're getting there now, we're getting there. There are other treatments coming up, and NICE, which is the National Institute for Clinical Excellence, are encouraging podiatry to try and find new methods of treating verrucas, so that we can move away from the more traditional caustics, the burnings. So as you can see here, I'm done here now. I'm going to just dress it with a nice clean dressing, and we'll see the lady then in a week to 10 days. She just keeps that on for the next day or so, and can redress with just a dry dressing. It's nothing fancy, it's literally just a plaster. The anaesthetic lasts for an hour or so, and then she can just treat it as normal then after 24 hours. So yes, we've been asked to move away from the more traditional caustics and stuff. So yes, coming up with better, safer methods for treating verrucas is very much you're kind of on the agenda for us as a profession at the moment. Say there are other treatments like laser and microwave therapy is doing some pretty decent things with certainly one specific type of verruca. There have been some really good results with that. And so there are a lot of practitioners now who are getting kitted out with that. So this is 7 to 10 days after. It's like a big scabby area. So basically I remove that so it's more comfortable. Basically, it's not giving her any real pain now, but I remove that, and then we can see what's going on underneath. So you can see the area's healing beautifully under there. We're still not quite there yet, but it's looking nice and clean. So as far as I'm concerned, that's really encouraging. Like I say, this lady did opt for some padding to kind of make it a little bit more comfortable. So this is with the padding on, and then I'll pop another dry dressing like I did initially on, and she'll leave that on for a day or so. So thank you very much for watching. I hope you very much enjoyed it. If you have any questions, please do comment, and please like and subscribe us for more. Bye.